Imagine this. You've been taking medication for weeks, maybe for blood pressure, depression, or even allergies. And suddenly your sex life changes. You're wondering, is it me? Or could it be my pills? Chapter 1. The hidden link between medications and ED. Most people don't realize that some medications can quietly affect sexual performance. It's not because the medicine is bad, but because certain drugs can interfere with blood flow, hormone levels, or nerve signals. 3 key factors in getting and keeping an erection. And the tricky part? These side effects are often not mentioned in casual doctor visits unless you bring them up. Chapter 2. Common medications that may cause ED. Here's the truth. Blood pressure medicines like beta blockers and diuretics can reduce blood flow to the penis. Many antidepressants, especially SSRIs, can lower sexual desire and make it harder to achieve orgasm. Anti-anxiety meds can dull the nervous system's response. Certain allergy or acid reflux medications may interfere with hormone balance. It doesn't happen to everyone, but when it does, it can be frustrating and confusing. Chapter 3. Why these side effects happen. Think of an erection like a team effort. Collaborator sends the signal. Blood vessels open up. Vigorously hormones keep the desire alive. When a medication disrupts even one of these steps, blood flow, nerve signals, or hormones, ED can show up. Sometimes it's temporary and fades after your body adjusts, but sometimes it stays until the medication is changed. Chapter 4. What you should do. Here's the most important thing. Never stop your medication without your doctor's guidance, especially if it's for heart, mental health, or blood pressure. Instead, talk openly to your doctor about the side effect. Ask if there's an alternative drug or a lower dose. Consider lifestyle changes to support your sexual health while staying on treatment. Chapter 5. The takeaway. Medication-induced ED is more common than people think, and it's nothing to be ashamed of. The key is understanding the cause and working with your doctor to find a balance between treating your main health issue and protecting your sexual health.